So I guess when the pandemic hit, a lot of our labs had to be shut down because we couldn't figure out, how to have in-person activities happen safely. And so I think that was a sad thing for all of us who are very active in our labs for our research. So we started to see wastewater surveillance, news articles that were touting the ability to be able to predict where there were likely to be new cases of the virus pop up and where there were indications that there would be a spread, and that might be able to be useful in helping to inform, stay-at-home policies and just be used sort of at the community level. And I thought, well, this is interesting, but my lab group doesn't do work on viruses. I'm not a pathogens person. I'm a water quality person from a chemical perspective. So I had to reach out to some folks who do the virus analysis to try to learn, who on campus can help us build out this team. If we can do sort of the pharmaceutical side of this project, how could we also do the virus side of this project? The College of Agricultural Sciences, as well as Penn State as a whole, really thought about ways that it would be able to provide some initial funding for faculty to do something with their research skills to help benefit something during the pandemic, depending on what the research topic was. And that allowed us to basically do demonstration in the lab so that we could show that we could detect SARS-CoV-2 in the wastewater. My research group had been working with wastewater treatment plants already. We already had those partnerships. And so it took me some time to figure out how we could leverage what we do in my lab group to address this problem that the whole world was facing.
So the wastewater comes into the system, and one of the things we want to know about is how strong the wastewater is, both from a traditional wastewater standpoint as well as the interest from researchers in the COVID virus levels of that wastewater coming from campus. So part of this initial treatment system is to take a sample of that incoming wastewater that comes from campus. We have here a composite sampler. So we take a 24-hour composite sample of the incoming wastewater prior to any treatment. And we take that sample, and that's ultimately what we provide the researchers for their research with regard to wastewater surveillance for the SARS-CoV-2 virus associated with COVID-19.
So what Fran's doing now is taking a 1 liter water sample and then it will go into what we call our solid phase extraction step. And so what's happening is we're running the water sample through the solid phase extraction cartridge at a relatively slow flow rate, because what we need is for the pharmaceuticals that are in the water to actually transfer from the water phase to the solid phase. And that will allow us to capture those pharmaceuticals on the media, where we can then extract them later and get them into a much more concentrated volume so that we can detect them at a level that our instrumentation is able to detect. We had been looking at pharmaceuticals in wastewater since 2016. Typically, we would look for over-the-counter pain medications, fever reducers, and so we realized that this would be useful for this project, right? Like people, if they have mild symptoms, are going to be taking painkillers and fever reducers. So we were looking for acetaminophen and naproxen. We also looked for new therapeutics. So we were interested in if remdesivir and dexamethasone would show up in some of these samples, because those were being used for treatment in hospitalized patients, especially people who are on ventilators. And another thing that we included in this that we hadn't looked at before was some antidepressants and anti-anxiety medications, because clearly there was a lot of stress going on in communities during the especially earlier days of the pandemic, as people were sort of trying to figure out what the new normal of their life looked like. And so that was something that we thought might give us an indication as to what the mental health of the community in the wastewater treatment plant service area was experiencing. And so that was sort of how the first phase of this project happened. But then once we had those partnerships and we were able to demonstrate capacity in the lab, then we were able to figure out a way that we could grow this offering of analysis to more than just Penn State and the local University Area Joint Authority. So I actually got a call from someone at Pennsylvania Sea Grant asking us to submit a proposal to funding that they had available. And it was very fast that all of that happened. So we went from basically thinking that we were going to collect weekly samples from only 2 wastewater treatment plants to collecting daily samples on campus and with the University Area Joint Authority as well, because there was so much interest in this data at the university level. And then also adding new partner treatment plants through the grant the grant funding that became available through Pennsylvania Sea Grant. So we just grew way more, way faster than we thought we would. And so it was really exciting to be at this place where, you know, our lab wasn't shut down anymore. Our students were re-engaged. They were excited about sort of this urgent project that was able to contribute back to the community and to link things that our lab group was already doing and good at with this new exciting virus analysis component as well. So oftentimes when we do research, it can take a long time, maybe on the order of years, before any of our data has an impact. What we were able to demonstrate then with the Sea Grant funding is what that level of impact can have on a project that's already gotten off the ground, because that money didn't have to get invested into method development or us figuring out what we were doing. We were already established at that point, and that allowed us to have data that were of a high enough quality that they would be useful to the Department of Health. And so that allowed us to then, you know, have this bigger impact not only across the state, but hopefully as a model for other institutions to be able to leverage different levels of funding and grow that impact over time.